Today, the Polk County Health Department expands its list yet again of those who can receive the COVID-19 vaccine. Now includes those under the age of 64 with underlying health conditions. WHO 13's Taylor Musgrove joins us now with more details. Good morning.
Good morning, Andy. These underlying health conditions include those with cancer, who are pregnant, obese, have a heart condition, have a diabetes, or people who smoke. When determining if someone has an underlying health condition, Polk County will be using an honor system.
You tell us you have an underlying health condition, we're going to believe that you have an underlying health condition. But it's also really important to think about that there are people who are in dire need of this vaccine. And if you do not have an underlying health condition, continue to practice those COVID-19 mitigation strategies that we know that work.
Director of the Polk County Health Department says the department has recently received an increase in Pfizer vaccines, which allows the county to add more phases to its distribution. All Polk County hospitals, clinics, and selected Medigap pharmacies will also continue to vaccinate phases 1A, 1B, Tier 1 in those 65 and older. Now, many people are wondering why those with underlying health conditions that are considered preventable diseases are a priority to the state right now. According to the CDC, those with diabetes, heart disease, hypertension, poor lungs, or those with a compromised immune system are 6 times more likely to be hospitalized from COVID-19 and 12 times more likely to die. A physician from Mercy One Des Moines says that public health organizations are really working to eliminate severe cases of COVID-19 before reaching the general public.
We have to decrease hospitalization and deaths. Other than that, mild COVID will hopefully die down as influenza does every year. But severe illness is what we need to prevent deaths.
Now, starting next Monday, Polk County will start vaccinating farm workers, frontline workers, and people with disabilities that are living at home along with their direct staff, Andy.
I think smokers, one of those groups, and the underlying conditions that people have questions about. The CDC did say, though, that they are more likely to have lung conditions, COPD, heart disease, high blood pressure, conditions which would put them into the higher priority group. So go ahead and get that taken care of now. Thank you, Taylor.